Welcome to the BanishCancer podcast. I'm Rachel, and today I'm joined by James, a cancer wellness educator. We're focusing on a critical subject, acute lymphoblastic leukemia, or ALL, what it is, the symptoms to watch for, and why early action matters.
Thanks, Rachel. ALL is a type of blood cancer that starts in the bone marrow. It happens when immature white blood cells, called lymphoblasts, multiply uncontrollably. Instead of protecting the body, they crowd out healthy red blood cells, platelets, and normal white cells. That leads to anemia, infections, and bleeding problems. ALL is the most common leukemia in children, but adults can develop it too.
That's a powerful reminder of how disruptive this disease can be. Let's talk about the symptoms. What should people be looking out for?
One of the first signs is persistent fatigue and weakness. This isn't just being tired after a long day. It's exhaustion that lingers, caused by a shortage of red blood cells carrying oxygen. Patients may feel dizzy, lightheaded, or short of breath, even after simple activities.
And infections are another big warning sign, right?
Exactly. Frequent fevers and infections are common because the immune system is weakened. If someone keeps getting sick or has fevers that don't resolve, that's a red flag. Night sweats and loss of appetite often appear alongside these infections.
What about bleeding and bruising?
That's another key symptom. With ALL, platelet counts drop, so patients may bruise easily or bleed more than normal. Nosebleeds, bleeding gums, or tiny red or purple spots on the skin, called petechiae, are all warning signs.
And there are other physical changes too, right?
Yes. Swollen lymph nodes in the neck, armpits, or groin can appear. Some patients experience bone or joint pain because leukemia cells build up in the marrow. Others feel abdominal discomfort from an enlarged spleen or liver, which can also cause a sense of fullness or unexplained weight loss.
The challenge is that many of these symptoms could be mistaken for everyday issues. Tiredness, a cold, or even sports bruises.
That's true, and that's why persistence matters. If symptoms don't go away, or if several appear together, it's time to see a doctor. A hematologist-oncologist can run blood tests, and if needed, a bone marrow exam. These steps are straightforward but life-saving.
Let's talk about why early diagnosis is so critical.
Early detection changes outcomes dramatically. In developed countries, children diagnosed early with ALL have an 85 to 90% 5-year survival rate. Adults face a tougher road, but early treatment still improves chances significantly.
Are there different types of ALL?
Yes. B-cell ALL is the most common, making up about 85% of cases. T-cell ALL accounts for around 15%. Knowing the subtype helps doctors choose the right treatment, which may include chemotherapy, targeted therapy, or stem cell transplants.
So if someone listening takes one thing away, what should it be?
Don't dismiss persistent symptoms. Fatigue, frequent infections, unusual bruising, swollen nodes, bone pain. These are the body's warning lights. They may look ordinary, but together they can signal something serious. Acting quickly can mean the difference between delayed treatment and a strong chance of recovery.
That's such an important message. Today we've walked through what ALL is, the symptoms that often get overlooked, why persistence matters, and how early diagnosis can save lives. We also touched on the subtypes of ALL and the treatments that follow. It all comes back to awareness, knowing the signs and acting on them.
And thank you to our listeners. This has been the BanishCancer podcast.